Thanks very much indeed, Alex, and thank you very much, ladies and gentlemen, for making it to this stage in the day. And my title, I have to say, is not meant to be dishing the dirt on my new collective term, a basket of funders, which I think is a great phrase. Thanks for that, Martin. But it's meant to be a little bit provocative, and it's meant to be a little bit black and white, because actually I think before you decide to dip your toe into the biobanking activities, you need to think a little bit black and white, otherwise you will set yourself up for disappointment and behaviour, and perhaps withdrawal of funding, and perhaps cessation of activities. So, but also there is an irony in this, because within the title here, if only I'd known what the previous speakers were going to talk about, because I've been sitting here all day long and saying, I was going to say that, I was going to say that. So rather than being a warm-up act for the discussion sessions which are coming up, maybe I can act as a summariser of the day so far. So my big piece of advice is, before you get into this, look before you leap. Make sure you plan, and plan carefully, and that your plan hangs together before you commence any activity. Don't be tempted by the fact that you can get samples, therefore let's start stuffing them in a freezer somewhere. You know, think rationally. Why am I doing this? What type of biobank am I going to be doing? Where should it be? Perhaps it should be hosted in this national centre, for example. How am I going to do it? Do I have a realistic start-up and operating plan? For whom am I doing this? Do you know your clients? Do they know what they want? Do you know what they want? What resources will you need to do this? Whose backing will you rely upon? Your institution, funders, other collaborators? Do they understand what they're getting involved in, and are they with you for the long term? Where will the samples come from? Do you have a secured source of patients and samples? How will you financially sustain the biobank? Well, Martin's already touched on that, so I'm not going to say much about this, but biobanking sustainability is a real issue. Nearly as many biobanks close as they do start up, and particularly, just to back up your point, I firmly believe a biobank is a public amenity. Of course it can charge for its services, but it can never recover its costs. I don't think that's ever realistic. Do you have a fixed term objective, or will you operate as a going concern in the long term? And do you have your biobank governance worked out? So I'm going to touch on some of these very quickly. So why are you setting up a biobank? Well, I don't think many of us would disagree with this conceptual pyramid of the relevance of models of human disease. Human cells or fluids or tissues or organs in the laboratory probably come second only to the walking, breathing, living human in the clinic. And all of us, you'll see a clinical trial, a well-controlled clinical trial at the pinnacle of this. But remember, as you go up this pyramid, the relevance of the model might increase, but it becomes slow and it becomes expensive. And you have to realise that before you set off. And remember, funders and researchers always want to gravitate towards something that's easier to access, easier to study, faster and cheaper. So there's a bit of a conspiracy working against you right from the moment you set off. It's a tension here. What type of biobank will you operate or participate in? Well, some of this has been touched upon earlier today as well. Tim told us very beautifully about the population-based biobanks, such as UK Biobank. You know, they're prospectively recruited from a special population. It's a study that's usually outside of the context of routine clinical care. The biosamples and data are collected either at a single time point or on a longitudinal basis. There is no intervention to the participants, and they're most useful for finding factors associated with causes of disease and biomarkers of risk or disease susceptibility. That's a big undertaking if you're going to get into that, and I recommend you don't unless you're part of a big consortium of well-funded people. Yeah. Clinical disease-associated biobanks are probably what are most familiar to this group. You can have prospective donation during the course of routine clinical care. The biosamples are usually collected at a single time point, but they may be collected longitudinally. They can also be accessing a retrospective collection of samples opportunistically that are already in NHS pathology department archives, for example. Again, there's no experimental intervention here. And these can be useful for a variety of things, including finding causes of diseases, elucidating molecular pathways associated with disease, or the adaptive pathophysiology, and also for all sorts of biomarkers, diagnostic, prognostic, predictive biomarkers, or even finding new therapeutic targets. So that's probably the one that you're most familiar with, I think. And then, of course, there will also be clinical study-associated biobanks. And these are the ones that we referred earlier on to as clinical trials. The participants are recruited to a particular protocol. It can be single time point or longitudinal. A variety of different types of samples can be collected. If it's a clinical trial with an experimental medicine, it's interventional, but of course it can also be an observational study. And a wide range of possible uses can be made of these types of samples. Pharmacogenetics, pharmacodynamics, adverse effects or toxicity monitoring, identification, testing of companion diagnostics, stratification of responders and non-responders, etc. And just to follow up on that, I think people these days are beginning to think of samples from clinical trials in particular in three categories. There are the primary samples that are taken for pre-designed assays. They have a use already identified, and they have a question that they are designed to answer, and they are often taken to fulfil regulatory requirements. And sometimes samples are also kept back for a number of years during the conduct of the trial or even after the trial is completed, because there are secondary questions that arise that are directly related to the trial. And in fact, the regulators may come back and ask you to do supplementary analyses. And certainly in a pharmaceutical context, these fall within a GCP type environment here. But the third category is the category that is underutilised, I think, and these are the opportunistic collection of samples from clinical trial participants for future undefined uses that are not necessarily trial related. And of course, this collection can then sit outside of the GCP envelope. It's opportunistic, and the uses are not necessarily directly related to the trial. And this is an untapped opportunity, I would say, for a stratified medicine type approach. But now I'm speaking from the point of view of a pharmaceutical company. 90% of the samples we use involve donation, but no banking. The biosamples are available to us as a byproduct of surgery or unfulfilled transplantation or unfulfilled blood transfusion. The samples are fresh and functional, and that's exactly what we use them for. We use them for functional studies in vitro, including ADME and tox studies and predictor of adverse effects, finding alternative indications, but also finding out the effects of the blood, for example, on our compounds. And actually, that's 90% of what we do, and that is an exceedingly difficult space to get supply for, because everyone's obsessed with stuffing things in freezers for some future. So I would like to encourage you to think that biobanking isn't about storage. So let's talk then about what premises you might have. This, I bet you, is what you're all thinking about a biobank looks like. It's maybe got a processing lab and storage facilities, whether it be nitrogen or mechanical freezers or whatever. But I'd like to challenge you to say, actually, let's stop talking about biobanks and let's start talking about biobanking. Because biobanking is a range of activities that extends from the patient through to the analysis of the sample in the end. So it's a whole lot of activities associated with the recruitment of the patients, the collection of the samples, the characterization, the samples processing, of course, storage of the samples and associated data, and of course all the relevant processes, policies and governance arrangements that wrap around this. And of course it can also include the management of the physical structure. So if you're going to participate in biobanking, you have to decide, are you involved in all of this or are you involved in some parts of it? And if you're only involved in some parts of it, who's doing the rest of it? That's the blind spot in many organisations when they kick off. So Yeah, so where are we going now? A plethora of new initiatives. I think that's one of the issues. The biggest challenge that we face, and I think Martin spoke about it as well, but actually Alex mentioned it earlier on, is we are obsessed by starting things, stopping them, closing them down and restarting them under another name, under another government initiative, under another funder's banner. And we have to think on a more long-term basis if you're going to do this. And UK Biobank, I think, is unique in its ability to have secured long-term planning and long-term support. So to bring that all together then, I'd like to say, if you're going to kick this off, you have to think of all the ingredients of research biobanking. You have to think, what's your purpose? Who do you have to work with to get patients and samples? What sort of clinical and laboratory and repository operations do you need? Are you going to do it internally, or are you going to outsource it to somewhere like Tim's new place in Milton Keynes? You have to think about the regulation, the governance and the compliance aspects. You have to think about quality management. But most of all, you have to remember that you sit within an ecosystem of a diverse range of stakeholders, and Maggie demonstrated that to us earlier on as well. You have to be willing to talk to all the various people involved in all the different parts of the ecosystem that might be internal to you, but you might also have stakeholders outside who deal with all of these. So as to get a balanced diet, you need a variety of flavours. And again, too many people, I think, set off thinking clinical laboratory and repository operations, that's a biobank. So back to what resources will you need? People, premises, equipment, money, and whose backing will you rely upon? So you will require expertise in the science that you need to serve, in sample handling and biobanking related science. You will require expertise in the legal framework and the regulations that you need to comply with. You will require expertise in relevant aspects of bioethics that we've also heard about today as well from other speakers, and how to navigate the ethics committee systems. You will have to have some aspects of quality management. If it's the old story, if you put garbage into analysis, you'll get garbage back out again. You will have to be able to discriminate between all the various guidelines that are out there, to discriminate between what might be best practice and what might be a minimal requirement, because the likelihood is you'll be shooting somewhere in that zone there. And almost everything we've talked about today, I have also heard talked about in other countries at various times in the last 10, 15 years. We are not alone. All of these same questions are being asked and partly answered somewhere else. So think beyond the confines of your own institution, think wide, network with people. These people might be your competitors for funding. They might even be in another country and therefore your international competitor. But work with them. The solutions are out there. We don't need another model for patient information for consent. There are several perfectly suitable ones there already. We just need to use it. So think broadly. So where will your biosamples come from? Do you have a secured source of supply? Maggie pointed this out earlier on. Every biosample that we have depends on a person, and that person needs to be considered. How do we access them? How do we speak to them? How do we encourage their participation? How do we treat them with respect? That's something that I find surprisingly lacking from time to time, especially since any of these people could be yourself, your wife, your husband, your mother, your child, whatever. And so we have to remember that behind the aliquot there's a person. And people are hard to access. And one of the biggest bottlenecks, I think, certainly I have experienced in the past, is health services, for better or worse, provide not an open access to their patient resources, but in some way strangulate supply. It's the same for clinical trials, never mind biobanking. Accrual rates are never as you wish for, and they are never what they were promised to be. And so you have to be realistic about that as well. And people are precious. Once people do donate, you have a duty to try and fulfill their donation, and not just to see that donation as ending up in the trash can there. But I spoke about the expertise that you need to assemble. This also applies to your staff, and this is one of the downsides of a plan that is flawed or funding that is fragile. It throws away expertise and people then end up being laid off or leaving the field. There aren't so many of us around who know about this business. We have to make sure we look after that knowledge capital better. So nearly at the end, I won't talk about the financial sustainability because Martin, I think, has demonstrated that nicely. Of course, you do have to think, do you have a fixed term objective or are you going to be a going concern? If you're a biobank set up to collect a particular set of samples from a particular set of clinical trials, then maybe you have a fixed term objective in mind. If, however, you have grand plans for many years to come, like UK Biobank is, you have to make sure that your going concern plans are robust. So it's back to the biggest challenge that we face is we can only look beyond the next grant funding round, we can only look beyond the next general election, the next change in government and public policy, and that is an issue for us. So, biobank governance. This is just to be a little bit provocative. We heard very nicely about what used to be GP, what was it called before? GPRD, but is now not GPRD anymore. As an example of a data bank, and we must remember that biosamples always come with annotation or need annotation attached to them. But in addition to that, samples themselves represent latent data. They are in some regards the same as a USB stick. They contain sensitive personal information that needs a technology to make them human readable. And for that reason, in many countries of the world, actually in Denmark, where I'm based just now, the primary law governing biobanks is the Data Protection Act. So we have to remember that in governance terms, the management of samples can be very similar to the management of personal health data. Okay, we have to do this well and we have to do it responsibly. If we let down society, and Maggie very nicely quoted from the CCB principles document, which I'm proud to have written the words that you quoted. If we betray the trust of our participants, then it destroys everything. This guy here was king of the world once. It didn't take him long to fall. And we don't want to end up as being the subjects of studies of books like this, that tell horror stories about well-intended biobanking initiatives that let people down, and in fact don't even let people down, but endanger people's rights. So we have to do it responsibly. So getting the governance right is very important, and I'm not going to read through this in the interest of time, but these are the things you have to have in place. You have to know that you need them, and you have to put them in place. So, I think we're at the end here. Quotes? Yeah. There is no one size fits everything in this business. You have to know what your particular interest is, what your particular need is, and make sure that you have the correct adapter to make it happen in your circumstance. And I think that's all I want to say.